What is cholesteatoma? Cholesteatoma is a condition where skin from the ear canal and eardrum gets pulled into the middle ear. This happens because of prolonged negative pressure inside the middle ear, almost like a vacuum pulling the skin inward. Over time, this trapped skin grows and starts eroding the surrounding bone. To better understand this, we need to know how the middle ear normally functions. The middle ear needs a constant supply of air and must maintain pressure equal to the outside atmosphere. When this air supply is interrupted, negative pressure begins to build up inside the middle ear. Negative pressure doesn't always affect the whole middle ear. Sometimes, it's just a small pocket or a part of the eardrum that gets pulled inward. Skin from the ear canal begins to collect in this pocket, forming a sac made up of dead skin cells. Over time, this sac continues to accumulate skin flakes from the ear canal. The increasing weight of these flakes enlarges the cavity and allows it to expand further into the middle ear. As cholesteatoma continues to grow, it starts invading the delicate structures of the middle ear. One of the first structures to be affected is the tiny hearing bones, the incus, stapes, and malleus. These bones play a crucial role in transmitting sound from the eardrum to the inner ear. As cholesteatoma erodes these bones, hearing loss begins to develop. The disease can also affect the bony canal that houses the facial nerve in the middle ear. When this happens, it can lead to facial paralysis, causing problems such as inability to close the eyelid, deviation of the mouth, and weakness of the facial muscles on that side. If the disease progresses further and damages the base of the stapes, the smallest bone that connects to the inner ear, the infection can spread into the inner ear. At that stage, symptoms of inner ear involvement may appear, including vertigo, ringing in the ear, and severe hearing loss. This is why cholesteatoma is considered a dangerous ear condition. It does not simply remain as an infection but gradually expands and damages important structures of the ear if not treated in time. Causes. Cholesteatoma doesn't have just one cause. It usually develops due to negative pressure in the middle ear. Here are the common causes. 1. Frequent nose infections. These can repeatedly block the eustachian tube and disturb middle ear pressure. 2. Mucosal folds in the middle ear. Some people are born with these, which can restrict airflow in certain areas. 3. Blockage of isthmus anticus and isthmus posticus. These small pathways help with ventilation. When blocked, a pressure imbalance occurs. 4. Allergy. Allergies can cause swelling and blockage of the eustachian tube. 5. Chronic sinusitis. Thick mucus can block airflow to the middle ear. 6. Enlarged adenoids or extra tissue in the nasopharynx. These can obstruct the eustachian tube and reduce ventilation. All these factors lead to one common problem: poor ventilation and negative pressure in the middle ear, which can eventually result in cholesteatoma. Symptoms and complications. Many patients don't come with early symptoms of cholesteatoma. Instead, they come when complications have already developed because the initial signs are often ignored. Here are the important symptoms and warning signs. 1. Foul-smelling ear discharge. Usually watery with a strong, unpleasant odor. 2. Occasional ear pain. 3. Blood-stained discharge at times. 4. Fluctuating hearing loss. One unique symptom of cholesteatoma is fluctuating hearing loss. In cholesteatoma, hearing loss starts when the growing sac erodes the middle ear bones and disrupts sound transmission. At times, the sac can act like a bridge and temporarily transmit sound, improving hearing, but when this contact is lost, hearing drops again, so it appears to fluctuate, though the damage is permanent. Stages, more serious symptoms appear. Sudden increase in hearing loss, when the disease reaches the inner ear. Tinnitus, ringing or buzzing sounds. Vertigo, spinning sensation due to inner ear involvement. Facial paralysis, affecting eyelid closure, mouth movement, and facial muscles on one side. Diagnosis. Diagnosing cholesteatoma isn't just about spotting it, it's about finding the cause. Doctors can easily identify it using simple tools like otoscope or diagnostic endoscope, but understanding why it formed often requires surgery. There can be multiple underlying causes, and identifying all of them is not always possible during initial evaluation. The full extent, severity, and the complete list of causes of a cholesteatoma are often confirmed only during surgery, when the middle ear and mastoid are directly examined. Treatment. Cholesteatoma needs surgery without exception, unfortunately. Surgery is not just for treatment. It is also crucial for diagnosis. The full extent of the disease and all its causes, often multiple, are usually discovered only during the procedure. The surgery is done through a small cut behind the ear to access the middle ear and mastoid. Doctors will perform below steps as per the requirements in the surgery. 1. Remove the cholesteatoma. 2. Clear blockages. 3. Reconstruct the eardrum. 4. Repair damaged hearing bones. In some cases, allergy or sinusitis also needs treatment. The surgery typically takes 2 to 7 hours, but the exact duration, and even the cost, can only be determined once the surgery begins, depending on the extent of the disease. The success rate is around 99% in experienced hands. Sometimes, a second surgery may be needed after 9 to 12 months. Early surgery is important to avoid complications. Home remedies. Cholesteatoma cannot be cured at home, but in some cases, you may be able to slow its progression, depending on the cause. The effect of home care mainly depends on what is causing the condition. Manage allergies and avoid known triggers. Treat chronic sinusitis, don't ignore it. If sinusitis and repeated middle ear infections are the cause, your ENT may also recommend sinus surgery, as cholesteatoma will be considered a serious complication of chronic sinusitis. To protect your ears, meanwhile, do regular steam inhalation and follow the instructions given by your ENT. Focus on your overall health. Maintain a healthy diet, good sleep, and daily exercise. This helps control sinusitis and reduces frequent colds, which can otherwise worsen the condition. Complications. Cholesteatoma complications are common because many patients delay treatment. These include erosion of the hearing bones leading to hearing loss, facial nerve damage causing paralysis, inner ear involvement causing vertigo, tinnitus, and permanent hearing loss. Rarely, the spread of infection to the brain. Some complications are detected only during surgery and may require urgent intervention. To know more, please read our article, Understanding Cholesteatoma, Symptoms, Causes and Treatment. Link in the description. Stay healthy. Stay happy.